Hello, everybody. This is Dr. Stephen Loam, cardiologist, Rush Copley Medical Center in Aurora, founder of pbnm.org, and welcome to today's session on why doctors do not recommend plant-based diet. So I thought this was a super important topic to go over because we really like to understand this. If we get a good grasp as to why doctors don't recommend this to a large number of people, then we will actually be able to have more of an understanding as to how we can change that so that more doctors can actually recommend it and hopefully save more people's lives and get more people to change over to a healthy way of eating. So we're going to examine this step by step. But another major reason why I wanted to present this topic is my own personal story and my own personal mindset, because I'm being a cardiologist, I thought I was training all the right evidence-based stuff. However, when I was able to overcome my own food addictions and obesity-related issues and lose a lot of weight, and I watched Forks Over Knives, which changed my life, of course, for the better, I started questioning, and I said, wait a second, why isn't it that I wasn't trained in this? Why isn't it more doctors don't recommend this? Is there something that I'm missing here? Because the power of a whole food plant-based diet is more than any other intervention that we could do for cardiovascular disease. And as a cardiologist, obviously that's what I want to do, is the best thing for my patients. So powerful. Why aren't more people recommending this approach? And so it really frustrated me, thinking, well, I looked at the science, it's real stuff. Why is it that more people aren't recommending it? And so that allowed me to go and examine all of the different possible reasons that doctors don't recommend this. And I actually compiled a good handful of reasons. And so let's go through them all, and let me give you my thoughts on them. And then hopefully we'll be able to have a better understanding where it is when your doctor that sees you might say, what is whole food plant-based? I've never heard of a plant-based diet. Oh, I don't know the science or whatever. You'll have a more understanding as to where they're coming from, whether it's a good thing or not, probably not a good thing. At least you'll have a better grasp as to why it is that that the doctors aren't recommending it. So why doctors don't recommend plant-based diets? So one of the first things is culture, right? So from a very young age, from childhood, even doctors, like everybody else in America, they're culturally preconditioned to not understand a plant-based diet. They're culturally preconditioned to eat these types of foods. The cookies, cakes, donuts, and burgers, and fries, and hot dogs. That's American culture. So when you're a kid and you're already preconditioned to eat this way, and you grow up, and if you become a physician or a doctor, or any type of healthcare provider, you already have that bias that you were born into your culture to want to eat yourself these foods, which contribute to our chronic disease epidemic. So even if you were taught, which we'll get to that, a lot of doctors aren't taught evidence-based nutrition, but even if you were taught evidence-based nutrition, you still already have your preset biases about what it is that your parents taught you to eat and what your culture is telling you to eat, what's being marketed to you like crazy. And so all physicians and healthcare providers already have that cultural preconditioning that is set in their mind. So it's hard for physicians to grasp good evidence-based nutrition, whether it's whole food plant-based or any type of nutrition. Everybody's already set on their ways based on the way that they were raised. So culture is one huge factor, which was similar in my situation. I was raised on the standard American diet, and that's what my culture told me to eat, is those types of foods. That was cheap, it tasted good. So I went into my medical training culturally preconditioned that this is the types of foods that we're supposed to eat, and that's okay. And to not think about the power of good nutrition and lifestyle and how that would have on chronic diseases in general. So this is what this leads to, right? So the president of the American Heart Association suffered a heart attack at the age 52 presenting at a conference. Number one cause of death amongst cardiologists is heart disease, despite it being nearly 100% preventable through diet and lifestyle changes, staying physically active, staying thin, not smoking, and keeping your cholesterol levels at a crazy low level, which is best achieved through a whole food plant-based diet. So here we have a leader in the whole cardiology world that suffered heart disease and a heart attack, thank goodness survived. But we need as a healthcare system, as healthcare providers, we need to take care of our own individual health and be great examples so that we can help other people more. They always say, put the oxygen mask on yourself before you help somebody else. Well, that's the same for so many other different things, such as you got to take care of your own health as a physician or a healthcare provider before you can actually help other people. And it's very, very well shown that a doctor who eats healthy, a doctor that exercises, and a doctor that's thin will talk to their patients much more about eating healthy, exercising, and losing weight versus a doctor who doesn't eat healthy, doesn't exercise, and is overweight or obese. They won't spend the time with their patients. So you really have to do it yourself. So we, because of our culture and all these other things, are already preconditioned to not have a healthy mindset in general. And that's lifestyle in general, even more so. We're culturally preconditioned away from a whole food plant-based diet. So culture is one of the main founding kind of factors that stops people from recommending whole food plant-based diets. And look at this. No different than the way it was with the tobacco industry, right? We remember these things from the 1960s. Physicians used to recommend smoking. Physicians didn't think it was their job to talk to people about stopping smoking. Physicians didn't read the research about stopping smoking. And guess what? The research was clouded and confused because of tobacco industry funded studies showing that smoking is not all that harmful for you. They even used to recommend that pregnant people smoke, blow in her face, and she'll follow you anywhere. Isn't this crazy? So this was the marketing that went directly to the public. But you know what? The same marketing affects physicians and healthcare providers. So the average person smoked a half a pack of cigarettes per day in the 1960s. Just like today, the average person eats a huge amount of animal products and processed foods in their diet. Back in the 1960s, you went to a medical conference, it was a haze of smoke. Everybody smoked. Well, guess what? Now you go to a medical conference and it's a haze of animal-based foods and processed food and junk food. And there's really no difference. So back in the 1960s, they used to serve cigarettes in the hospitals, right? I actually even had a patient that told me the story and showed me the burn wound on their arm where the cardiologist dropped a cigarette on their arm during the procedure. The cardiologist was smoking during surgery and burned my patient. So now you fast forward to today, and they're not serving cigarettes in hospitals, but what are they serving? Eggs, bacon, and sausage, even sugar and other unhealthy foods. I had a patient who needed to have bypass surgery, and what were they fed? Meatloaf, mashed potatoes with a beef gravy and a Sprite, along with some crackers and Jell-O. It's like, geez, that's the food that caused the person's disease in the first place. That's not what we should be feeding people in hospitals, but that's a whole separate topic. So the whole analogy of the tobacco industry and all that went on back in the 1960s is perfectly related to current day. Doctors today don't think it's their job to talk to patients about nutrition that much, just like doctors back then didn't talk to patients about stopping smoking. Doctors today don't understand evidence-based nutrition, just like the doctors back then didn't study the research on smoking. And it's sad. It really needs to change. So we need a Surgeon General's warning on at least processed meats and sugar and other processed foods and red meat and such. And if we can get that Surgeon General's warning, just like we were able to get on tobacco, hopefully we'll be able to make an impact changing people off of animal-based foods and off of processed foods, junk food, sugar, and more towards a predominantly or exclusively, hopefully, plant-based diet, whole food plant-based diet. So this is the culture that is stopping a lot of physicians from recommending plant-based diets. So another reason is the money aspect of it. So if you think about it now, I strongly do think that a vast majority of physicians and healthcare providers, that this is not really the reason in the front of their mind. It's not forefront saying, hey, I don't want to talk to my patient about eating a whole food plant-based diet because if I do that, they won't need me anymore and they won't have a heart attack, they won't have a stroke, and the hospital's not going to make money. No, they're not thinking that. But they are conditioned because of our system to not think about diet and lifestyle. So doctors get paid for productivity. We get paid the more procedures we do, the more patients we see, the more we get paid. It takes a long time to discuss diet and lifestyle factors with the patient. So I get 15 minutes with the patient. All I can do is say, are you having chest pain? Are you short of breath? Let me examine you. Let me go through your pills and your blood tests. Let me go through your x-rays. And if I open up the conversation of, hey, what do you eat? It's a huge conversation. It's going to take a long time. And I'm not going to be able to see that many patients if I talk to all my patients about diet and other lifestyle factors. not going to be able to. So our current system, which we call the acute care model here in America, where we see patients 15 minutes, is not set up to allow us to have the time to discuss diet and lifestyle factors. And then again, even if you get your patient healthy patients don't need to see their doctors. So really, we are not financially incentivized. And I think most doctors, if they understood the data, if they read it and saw the power of plant-based diets and how important it is, they would try their best to do as best as they could in the time that they have with their patients. A vast majority of doctors are good, deep down caring individuals that want what's best for their patients. There might be a small minority that literally do foo-foo off diet and lifestyle changes because they're just like, who's going to do it? It's hard for people to do. And I'm not going to make money on it. I actually have had patients come to me and said, my cardiologist told me to eat whatever, and they'll take care of me if I have another heart attack. And I said, well, that's crazy. Actually, I think that's medical malpractice, honestly. And that should not happen. And those doctors, yes, they have it wrong, but that's a minority. But money does indeed influence it. And it's very similar to when I'm in committee meetings and hospitals say things like, how can we do more bypass surgeries? How can we do more stents? Because that's what they get paid for, right? And I raise my hand and say, how can we prevent more heart disease? Shouldn't we be preventing heart disease? That's what we should be doing. And they just say, yeah, no, we understand that. And yeah, we'll work on that a bit, but honestly, that's not what we get paid for. And so if we could just shift it so our healthcare systems and hospitals get paid for prevention of disease, that's when we're going to have the biggest success. And that's when we're going to get people saying, oh, let me read the real evidence on diet and lifestyle. And that's when we're going to get more people adopting the whole food plant-based mindset. So we need to shift our system to get paid for prevention. And they're trying to do that in multiple different ways with these accountable care organizations and such. And it's complicated. I'm not a complete expert in that, but they're trying to make those shifts, but it's just hard with all the industry influence against it. So money does play a factor, does play a role in this, but I don't think it is the prime driving force. But industry influence is big here because, like I can tell you stories, when I was a medical student, I used to get taken out to a steak dinner once or twice a month. And, students, they don't make any money. Actually, just the opposite. We're paying a lot of money. And if some drug company is going to take me out to a $50 or $100 dinner, and it's going to have a good time with our friends, and all they have to do is tell us for 20 or 30 minutes about their drug, we kind of get brainwashed in some senses that the only solution for hypertension is this pill, this pill, this pill. The only solution for high blood sugars and diabetics is this pill. Oh, cholesterol, this pill. They brainwash us so much into thinking about drugs, pills, and the device companies, procedures, that it just shifts us away from the mindset of diet and lifestyle. So industry influence is there in the medical world that does affect healthcare providers' overall decisions to recommend any diet or lifestyle change at all versus just prescribing the pills. Now, it used to be worse a long time ago where the drug companies would take doctors on cruises and the big ball games and do all these different things, and all that stuff is gone. So that doesn't happen any longer. However, there's still things, lunches, and doctors get paid to speak about drugs, and they do get some kickbacks and such. And so I'm happy to say that that's not me. I get no kickbacks. I don't accept anything from any pharmaceutical rep or device rep. So, more and more physicians are going that way, which is great, but the influence on medical students is there, and it has a ripple effect as doctors get older in the way that they practice medicine. So that is a big thing. The old school physician mindset is another reason that doctors don't recommend plant-based diets or even don't recommend any diet or lifestyle change at all. So what do I mean by that? From a heart disease perspective, I was taught that heart disease is a progressive disease. It happens with aging, that there's nothing you can do. It's, genetic. If you smoke cigarettes, you damage your arteries. So that's something that's important. But really, diet was not a part of it. In the 1950s, 60s, and 70s, when the older generation of cardiologists were trained, diet had nothing to do with heart disease. It wasn't taught. And even tobacco really wasn't at all. And so where I trained, wonderful, phenomenal place. I learned so much, and I'm very appreciative of the people who trained me. The professors, the two main guys that trained me, were caring, compassionate people that would hold their hand with their patient till the moment they died. They would fight for their patient, whatever. However, they were both obese and diabetic, and they didn't talk to the patients about diet and lifestyle because, again, they didn't do it themselves. They were so culturally preconditioned in order to eat an unhealthy diet and lifestyle themselves They were trained to push pills and do procedures. And so if they're not doing a healthy lifestyle themselves, especially a plant-based diet, why would they ever recommend it to their patients? So the old school mindset is the pills, pills, pills. But as we know, that makes no sense at all. The human body is an amazing healing machine. All we need to do is remove the thing that's causing the harm, that's damaging our endothelium, damaging our arteries, remove that, and the body heals itself. Why do we have the mindset that we need to add something to the human body? We need to add a pill, a stent, a bypass. That makes no sense. The human body is designed amazingly. We don't need to add anything. Just remove the thing that's causing the harm, the unhealthy diet, the tobacco, the sedentary lifestyle. You remove those and the body heals itself. No different than if you cut your hand with a knife and you sit back and do nothing, your body will stop the bleeding, form a scab, and will heal it up without anything. However, if you keep cutting yourself in the same spot 3 times a day, breakfast, lunch, and dinner, you will never heal up. We just need to give our bodies the chance to heal. And how do we give our arteries on the inside the chance to heal? Whole food, plant-based diet, 0 cholesterol in your diet, essentially no saturated fat in your diet, and not doing any endothelial injury, not causing any inflammation, because of course, heart disease, atherosclerosis is an inflammatory process. We don't want anything to inflame our systems. Animal products inflame our system, processed junk food, sugar, refined carbohydrates, they cause inflammation. Those are things to avoid. So if we just remove the thing that's causing the harm, we'll heal up. But that is not the mindset of definitely old school physicians, but even younger school physicians don't really think that way enough. But the evidence is very clear, and it just makes complete total sense. It does. And so this is the new mindset that the younger generations of healthcare providers really need to have, is let the body do its own healing, remove the thing that's causing the harm, and the body will get better, including reversal of coronary artery disease, reversal of diabetes, hypertension, autoimmune disorders. Even there's some good data on brain health and such. It just makes so much sense. So this is the new school mindset we want, is remove the thing causing the harm, and the body will heal. So then the physician, they're culturally preconditioned. They know they get paid more for productivity. They don't have time to talk to their patients about it. They think heart disease is progressive and diabetes is not reversible and all these things. Then they go through their medical training, and guess how much nutrition education that they get? They get like 0. So me personally, the only nutrition education that I really received was about some rare nutritional deficiencies, scurvy, beriberi, all these things, that malnourished countries get, but you don't see in America. You don't see that. Those types of nutritional deficiencies and those extreme calorie deficient, malnourished situations, they're easy to test those on board exams. However, evidence-based nutrition, it's more challenging, and it's just not taught. So I essentially had no formal evidence-based nutrition training in all of my time. 4 years of medical school, 3 years of internal medicine residency, and 3 years of cardiovascular disease fellowship, essentially none. And I was thinking about this as I was preparing for this talk, and I was like, you know what? Guess who gets more nutrition training than doctors? Kids. Kids get more nutrition training than doctors do, because the kids are required to learn this stuff in school. And granted, what they're getting taught, as you see in the background of this image, is the USDA Dietary Guidelines, the My Plates, which has dairy, 3 servings of dairy. They say protein, which they say to choose plant protein often. However, they still include animal-based proteins on there. But just in general, regardless of what the kids are learning, the kids are sitting there getting a whole curriculum in nutrition, and doctors are getting nothing. And I've talked about this before in my other videos, that the Global Burden of Disease study funded by the Bill and Melinda Gates Foundation has shown that dietary factors is the #1 cause of premature death in America, and the #1 cause of premature disability in America. So if dietary factors is the #1 cause of premature death, shouldn't diet and lifestyle and nutrition be the #1 thing that doctors are taught? It should be. And shouldn't it be the #1 thing that doctors talk to their patients about? It really should be. But there's this huge disconnect between what the science shows that we can do to prevent and reverse diseases through nutrition, through whole food, plant-based nutrition, and other lifestyle factors, and the actual practice of medicine. A huge disconnect. And we need to get rid of this disconnect and really get all of healthcare providers in America all on board with the same message, that lifestyle and diet first. And we need to do everything we can to support people with cooking classes and group support and regular visits with good evidence-based nutritionists, not nutritionists that are trained on USDA dietary guidelines, but good plant-based nutritionists that really can get the message out and get people to change in a healthy way. So no nutrition education for healthcare providers is another reason that that you don't hear doctors recommending plant-based diets. And then again, all these fat promoting books that you get. So a lot of doctors, they aren't getting any formal education in evidence-based nutrition. So where are they getting it from? They're getting it the same place the public gets it, right? They read these books and they get the nutrition training exactly the same place that everybody else gets it. They read Dr. Atkins' book, the South Beach diet, the paleo diet, all these things. And people love to hear this because they love to hear good news about their bad habits. These high-fat, low-carbohydrate diets are more aligned with our culture, more aligned with what our food system gives us, and to much of a degree, more aligned with what we are marketed towards to eat. And so this is easier for people to do, and they see short-term gains. They see weight loss, and sometimes diabetes gets better from the weight loss. Blood pressures can come down. Energy level can go up sometimes. Short-term. Did I say short-term? Short-term, because there is zero evidence to say long-term that any of these types of low carbohydrate, high fat diets, ketogenic diets and such, there's no data that says that any long-term benefits to this. Actually, just the opposite. There's plenty of data to show that doing these types of diets long-term increases heart disease risk, cancer risk, just overall mortality, overall death risk. There is no culture in the world ever described that lived long and thrived on a low carbohydrate, high fat diet. The blue zones showed all the longest living cultures in the world were predominantly plant-based, averaging 95% of calories from unprocessed plant-based foods. And so plant-based is the good way to go, and current scientific evidence supports this. And to take it to 100% plant-based is those people who have heart disease or diabetes or chronic diseases already, because don't forget those blue zones were 100% plant-based from the day they were born. From the day they were born, sorry, they were 95% plant-based from the day they were born. So if you haven't been eating clean from the day you were born, that's why after you're age 40, 50, or 60, and you're finally changing your diet, 95% might not be enough. Certainly that's good, but going to that 100% mark, so much magic happens with health. The American Academy of Lifestyle Medicine really advocates 100% whole food plant-based diets for anybody who has chronic disease of any type, heart disease, diabetes, hypertension, etc. So this is another reason why physicians don't recommend it. And here's another one, Mediterranean diets. So Mediterranean diets, they do have a lot of data to support them. So the gold standard in medicine is what we call a randomized controlled trial. A randomized controlled trial. So you get a patient that meets certain criteria, and essentially it's like you're flipping a coin. Half the people get this and half the people get that. And that's really easy to do when somebody is a pill, doing research on a pill. And you can even placebo control that, meaning you don't know if they're getting the pill or a fake pill, a placebo. With a diet, you can't do a placebo, but you could still randomize people to diets. And so Mediterranean diets have a lot more randomized controlled research to support them, the PREDIMED and others. So there's a lot of different data on the Mediterranean diets. And so since that's where the data exists, that's what's recommended. And so what did they do in these studies though? They compared Mediterranean diets to standard American diets. And yes, you could eat cardboard for breakfast, lunch, and dinner and be better than the standard American diet. Well, I don't know, maybe. But pretty much anything is better than the standard American diet. And so yeah, the data showed that a Mediterranean dietary pattern was superior to the standard American diet. Therefore, it's all of a sudden the recommendation. However, when you examine the data, it's clear that people who follow Mediterranean diets still develop heart disease and stroke and hypertension. It was just a lower rate than people who followed standard American. However, when you look at cultures in those blue zones that ate 95% plant-based on average from the day they were born, heart disease essentially did not exist. Many of those cancers didn't exist. Hypertension didn't exist. Overweight, obesity, diabetes, they didn't exist when they were eating 95% whole food plant-based. They didn't exist. And Mediterranean diets have no data to say that if you eat that way that your rates are going to be near zero for any of those chronic conditions, like there is data for whole food plant-based diets. So wait a second. So there's a lot of data on Mediterranean diets that are randomized controlled, therefore they're recommended quite a bit. But there's not a lot of randomized controlled data on whole food plant-based diets where they randomize people to plant-based diets versus whatever, Mediterranean or versus paleo or versus standard American. That data doesn't exist. And since a randomized controlled trial is one of the main gold standard in research, that data exists for Mediterranean and not for plant-based. That's why a lot of the people looking at the evidence, they don't really recommend whole food plant-based. However, when you look at basic science in the laboratory, it makes a ton of sense. When you look at epidemiology studies and observational studies, it always shows the more plant-based you eat, the better you're going to be. And again, when you look at centenarian studies, long-term studies of people who live the longest to 100 or more centenarian, plant-based wins all the time, just not the randomized controlled trials because they just haven't been done. So when you look at, there's a great book called The Longevity Diet written by Dr. Walter Longo, and he talks about the 5 pillars that you need in order to be able to recommend something, all the way from the basic science to the epidemiology and observational stuff, randomized controlled trials, centenarian studies. You need all of those. You need the diet to show good data in all of those pillars. However, if you look at just one pillar, you can make a lot of erroneous conclusions. Like if you look at just one pillar, you randomize people to a low-carb, high-fat diet, ketogenic diet. After 2 years, it looks great. It looks great. Look at they lost weight and their blood pressure is better and all these things look better. But long-term, no way. And that's why you can't just rely on one type of study, a randomized controlled trial. You can't just rely on one pillar. Look at the centenarian studies too. There's no ketogenic people culture that live to be long. And look at the basic science. Does it make sense on a basic science laboratory data cellular level that eating nothing but processed meats and bacon and butter and cheese and oils and stuff, does it make any sense that that's going to be healthy for you on a cellular level? It makes no sense. No sense at all. So looking at the totality of information on diet and how it affects chronic disease rates certainly favors whole food plant-based more than anything else. However, randomized controlled trials are strong in the Mediterranean world. When you think about what the true Mediterranean diet was, though, guess what it was? It was 93% plant-based. Very little meat, eggs, and dairy, very little. Granted, there was some red wine in there, and there was olive oil, which is highly processed, and we do not advocate. Olive oil is pure fat, still 14 to 15% saturated fat. It might be shorter chain saturated fats, but it's still not good, and it clearly causes endothelial dysfunction. Dysfunction of your arteries is very well shown by Dr. Vogel, a very well-known endotheliologist. So olive oil is not a health food, but when you compare it to butter or you compare it to animal fat, it's better. However, get all the oil or animal fat, butter out of your diet, and that's what's going to win, and that's a whole food, plant-based, no oil diet. So Mediterranean diets, that's why they're recommended a lot, and one of the reasons why doctors don't recommend whole food plant-based diets is because they've been recommending Mediterranean diets based on the fact that they have the randomized controlled trials to support them. So that's that, and this is the last reason. The last reason that that people don't recommend this, that healthcare providers, is simply people don't do it. People don't follow it. They don't listen. And it's just frustrating because if you look at this picture, I got this off the internet somewhere randomly, and I don't know if I could corroborate this or if there's been a publication that really showed this, but anecdotally to me personally, this seems right. This seems right to me. The average retention of patient education. So I talk to somebody in the office, and I could talk to them a lot. 80% of things are forgotten immediately. 80%. 50% is remembered, of what is remembered. Half of what they remembered is actually misunderstood. And only 10% of things are not only remembered, but remembered accurately. Now, this is in regards to everything, I'm assuming, nutrition or medications, or hey, we're going to do this test. What does this test entail? But this sounds about right. And so when doctors talk their patients' ear off about how important it is to eat healthy, exercise, lose weight, why it is you can get all your protein from a plant-based diet, why it is that plant-based diets can reverse heart disease, why you need to protect your endothelium by eating zero cholesterol and zero saturated fat. I could say all this stuff, and 80% of it's forgotten immediately, whether people were just kind of zoning out in the middle of my talking to them or what. And then when they do understand things, they still misunderstand it. We had people come in and say, yeah, I'm eating a plant-based diet. I'm doing really good, eating lots of beans, whatever. Yeah, I have about 1 egg a day, and I'm still eating some chicken here and there. I'm like, no, wait, that's not a plant-based diet, but they misunderstood it. They're thinking since they're eating more plants that they're on a plant-based diet. And so I clearly try to say 100% plant-based diet, 100% of calories from unprocessed plant-based foods. I show them that graph, the pie chart from the USDA that says, only 12% of calories in America come from unprocessed whole plant foods. And I say, I want you to make the green portion of this at least 90% and eventually get up to 100%. So you get all of your calories from unprocessed plant-based foods. But I can talk my patients' ear off about the benefits of a whole food plant-based diet, and they still don't do it. They still aren't compliant. They still don't adhere to it. And that's a frustrating thing for doctors. And so a lot of doctors just get frustrated with it and they give up on it. They just simply give up because they say, why should I talk to my patients about diet and lifestyle? They're not even going to change their diet and lifestyle. Even if I'm recommending Mediterranean, even if they're recommending whatever, a lot of times they don't listen. Then you go and you tell them they need to eat whole food plant-based, and that's even more of something that's against our culture and against our food system and the way they were raised. Even fewer people will be compliant to this. But here, let me ask you this question though. If we have a therapy that can essentially annihilate heart disease, can make it gone, a cure for heart disease, yet 600,000 Americans die for it every year, should we just say, people aren't going to do it? They're not going to stick to it. That's too hard for them to do. Is that really what we should say? Or should we say, okay, the truth is there, we have the science. Now we, as a healthcare system, we should say we're obligated now to make this a reality because this is the truth. This is what benefits the patients the most. This is what will benefit the health of our American population the most, is changing to a predominantly or exclusively, hopefully, plant-based diet. We need to make it easy for people. We need to do everything we can to make it easy for people to be compliant and be adherent. Anybody who's overweight, obese, diabetic, high blood pressure, heart disease, they see their doctor for their 15 minutes, fine. They must have a half an hour or an hour with a good nutritionist, exercise physiologist, psychologist, whatever. Psychologists can help people with food addictions and stress levels and helping people get better sleep. And the exercise specialist can help them stay physically active. And then obviously the nutritionist can promote the whole plant-based diet. But we need this comprehensive approach. We need to make it easy for people. We need good, innovative restaurants and food systems to be able to make it easy, not only to teach people how to cook the healthy food, but if they can't cook it, they don't have time, we need to have good food delivery services to give people healthy, whole food, plant-based meals. We need to just educate the right way. And so doctors get frustrated that their patients just won't listen or don't make any changes, so doctors just give up on it. And this is another one of the main reasons that doctors don't talk to patients about plant-based diets. So when you can annihilate heart disease, you can reverse it with a whole food plant-based diet. I feel as though we should be obligated as healthcare providers, as a healthcare system, to make our primary focus on helping people get to plant-based diets. We need to treat the cause of the illness, which is diet and lifestyle, endothelial injury. Despite it not being a moneymaker, we need to do this anyways, and we need to change our system. It just still blows my mind that we don't focus more on this. And so that is a little bit of what PBNM.org, Plant-Based Nutrition Movement, a nonprofit organization that we've developed, because we realize that healthcare systems really at the current state do not make money on diet and lifestyle related programs. And so why would they put the effort into helping people eat whole food plant-based if they really truly don't make money off of it? So we need to just take matters into our own hands, and we need to do something ourselves about it. So what can we do? Well, let's get healthcare providers together, and let's get dedicated community members together, and let's be the change ourselves. Let's educate the public directly. Let's do group meetings every single month where we talk about topics. We get people to sit down with healthcare providers' input and lectures and little potlucks and share recipes and support each other. And let's get everybody healthy. Let's do cooking classes where people could actually learn how great it is to eat this way. Food tastes great. It fills you up. You get all the nutrients that you need, and it's not that hard to cook it. And it's cheaper to cook this way. We need to dispel all those myths that are out there. And then immersions we provide, where it's a full day event where people just sit and learn about how heart disease develops and why whole food plant-based is the best way to go with other lifestyle factors. We need to really get these programs out there, available to people at a cheap, inexpensive cost, hopefully eventually free if we get enough sponsors and support, so that we can get this message out as a grassroots movement, because the change is going to happen from the bottom down, not from the top up. Healthcare systems are making plenty of money right now. The food industry is thriving, making plenty of money. The drug companies are making plenty of money. Why would they want to change our system? They really wouldn't. So the only way change is going to happen is if we demand it. So we're hoping to not only support the community, where a physician that finally gets it can say to an obese diabetic patient, hey, why don't you show up right over here? There's a group that's meeting monthly. They eat what's called a whole food plant-based diet. And this is what I would recommend that you follow. Show up, eat some of the food, meet the people, mingle, and we can all support each other to get the word out and to spread the good word. So this is what we need. And so we're hoping to do this. So really what our mission is to organize a combined effort of healthcare providers and community members, because there are a lot of doctors like myself that are frustrated that we cannot integrate lifestyle medicine and plant-based nutrition into our practice adequately. It's challenging to do and still be financially viable within a big healthcare system. It's hard. So all these healthcare providers that are frustrated with this are coming out and supporting our organization. And we combine them with these dedicated community members that get the message because of documentaries like Forks Over Knives and What the Health, and the upcoming documentary, The Game Changers, because of books like How Not to Die. There's a huge base of dedicated community people that really, really want to see this change happen to help save America from our chronic disease epidemic. And we want to fight together as healthcare providers and community members this chronic disease epidemic using whole food plant-based nutrition. And so the support that we've received has been absolutely amazing. Our Tampa group is going strong, now led by Dr. Kaushik Reddy, interventional cardiologist at the VA systems there. And we're starting other chapters in other cities and hope to be throughout the nation. And we want to dominate the whole country with this message, and so that we can all unify together and do things like tell the American Heart Association, listen, stop taking sponsorships from the Texas Cattlemen's Association, from Tyson Foods, from these drug companies. You need to promote a plant-based message. We really, really want them to align with the American College of Lifestyle Medicine. So that's pbnm.org. Check it out. Get involved. However you'd like to, we'd be happy to. We actually are doing a 5K walk run in the Chicago area in Elk Grove Village, right by Schaumburg, in a place called Bussey Woods, on April 27th, where we're going to have good old Dr. Khan, America's Heart Healthy Doctor, myself, Dr. Garg, and so far 14 physicians participating with people. We're going to feed a whole food plant-based meal afterwards. You're going to hear some presentations, some cooking demonstrations by plant-based chefs, food tasting, stretching out afterwards. It's going to be a great event to help support our grassroots effort in order to try to change our system, our healthcare system, our food system towards health and prevention of chronic disease, which is, of course, best achieved with a whole food plant-based diet. So hopefully you guys have got something out of this and understood from my perspective why it is that so many doctors do not recommend plant-based diets. I mean, part of it is just doctors don't recommend diet in general or lifestyle changes in general. But even when they do have the lifestyle medicine-oriented focus, why is it that a lot of them veer away from where the evidence is? Why do they veer away from whole food plant-based? And so we've discussed all that. And so now that we understand it, let's try our best to tackle these issues. Let's change our culture from a grassroots way. Let's change the education of physicians. Let's get out there and actually teach them evidence-based nutrition. And let's change our system so doctors actually get paid to get their patients healthy, which is really the way a true healthcare system should be, because the definition of the word health is the state of being free from illness or injury. Free from illness or injury. That's what we need, but our current system doesn't free people from illness. We don't cure heart disease or diabetes or hypertension. We just kind of control it with stents and bypass surgeries and pills. But if we really, really were to have a healthcare system, we would reverse those diseases with diet and lifestyle. So that's really what we need to do. So I'm going to open it up to questions here and see if I could grab any possible questions. If there's anybody that's listening in, let me look and see. Give me one second. So I see some comments here. Here we go. Thanks for joining. Thank you, Judy. Always a super strong supporter. Jennifer, thanks for being here. Thanks for taking the time. Appreciate it. So what Jennifer asked is, Dr. Loam is a future private practice plant-based dietitian. That's great. Yeah, that's awesome. Thanks for doing the right thing. I'm so happy to hear that. I wish we had more of you. What do I think would be the most effective way for you to communicate to physicians about the benefits of nutrition and referring their patients to you for guidance? As I expressed, the doctors have limited time with their patients, and I want doctors to know that they have resources and experts to turn to. This would be a collaboration between their expertise and mine, benefiting our patients. So yeah, that's a great question. So basically, how can we get more? So in two different parts of that question. Number one is, how can you just get more people to think about nutrition, just in general? And then number two, how can you get more people to think about plant-based diets and plant-based nutrition? So it's hard. It's hard. And I don't think that there's any good answer to that except for people to get out in front of their faces and to do things and get the education out there. Again, some people are so culturally preconditioned away from nutrition and diet and lifestyle change. And then also doctors are a little bit strapped by, they can only send people to nutritionists if their insurance company covers it for certain things. You know, diabetes, okay, fine. You can frequently get that covered. But if somebody just wants to lose weight, a lot of insurance companies, it's a challenge to get them to pay for nutrition counseling, which is wrong. I mean, again, this should be the number one thing. But medical insurances, I don't know why they're so misaligned as well with the whole nutrition message. So I think that if you're starting a practice up and you want to get more people to refer to you specifically, or just in general, it's just a matter of educating on why nutrition is so important. The global burden of disease studies, the rates of, obviously people get the rates of obesity and stuff like that, but just tell people, listen, I'm here for your patients. This is what I offer. And if you can get in front of more doctors and get them to think about the power of diet and lifestyle, that's what you have to do. One of the things that we're doing with PBNM is once we get everything organized, we're going to be going into healthcare providers' offices, feeding them whole food plant-based, and have a healthcare provider such as myself in there telling people why it is that there's so much data to support plant-based diets or just lifestyle medicine in general. We want to get in there and educate people. And then we want to be able to give them resources like give people your name and say, hey, listen, Dr. Smith, who's an internal medicine doctor, this is why plant-based diets are so darn important. Look at your staff eating this great whole food plant-based no oil meal. They love the food. It tastes great, right? And the science shows it can prevent and reverse heart disease. Here's a nutritionist nearby that would love to help take care of your patients. And if their insurance will cover it, come to our support group. And so that's what I would recommend you doing too. I don't know where you live. If you live nearby, what I would say is come find support groups that are plant-based and get there. People who just want to lose weight, who are diabetic, who have high blood pressure, whatever it is, just get in front of those people and let them know about your services and what you can do. So that's huge. So yeah, it's just education. So Rita, thanks for joining too. You said the same thing. You're training to be a nutritionist, nutritional therapist. It's hard to hear in classes some of the stuff that they say, but you're not giving up plant-based. Oh, I know what you're saying. It's hard to hear what they're saying because they're telling people still chicken is healthy for you, right? They're still saying use olive oil. And again, it's cultural preconditioning, and it's the randomized controlled data that actually show that Mediterranean was better than standard American. So that's what the data lies. That's what they're going to do. But we do know the truth, that it makes no sense that people should be eating these animal products or processed foods such as oils. So we just all got to stick together, and we all got to continue to be the change. And that's really the only way that we can do it. So yeah, great. So Jennifer, what else did you say? So hi Judy, you're in Central Florida. Yeah, maybe you're somewhere by Tampa too with Cow Sugar Ready. Get involved with their group if you're not already. I think you are, yeah. So get involved with them and just be active and spread the word. Is there a Facebook event for the 5K? Carrie, thanks for joining, Carrie. So I know, I believe that there is, and if there isn't, that's a great idea. We should get it going. We should get it up. It's going to be a great event because we want to use this not only, for a potential fundraiser for our organization. Our ultimate goal is to build a huge building that's a plant-based nutrition institute. Wouldn't that be great? But we want to use this as a means to educate the public. We just want to get every random person. I would love to get every hospital in the whole Chicagoland area to send a team out to this event and show people, like, listen, hospital systems, they do want what's right for their patients. Let's all stick together and let's promote plant-based diets and lifestyle. So every hospital, I'm hoping eventually within a couple of years to get a team out to an event like this promoting lifestyle medicine in order to try to be that grassroots change. So, oh, Judy already answered your question. We haven't created a Facebook event because of tracking issues, but whatever we can do to help support pushing this forward, that would be great. So Dr. Reddy is here too. Dr. Reddy, thanks. I already mentioned you a couple times throughout this. We're talking about why it is that doctors don't recommend plant-based diets in general. Why is it that it's not recommended? We've talked about so many different things, all the way from cultural preconditioning to lack of nutrition education to the randomized data supporting Mediterranean and lack of randomized controlled trials for plant-based diets and everything. But it makes so much sense to stick to whole food plant-based. So awesome. And Brian, thanks for joining. Brian Krieger. So I think, Is there any other questions here? Let me see. I don't see any other questions. So yeah, what I want to do with this in the future too, this whole Facebook Live thing is the whole point of it is to try to get as many of the general public who are just trying to lose weight or change their diet, change their lifestyle, to listen to some of the information out here so they can understand the power of lifestyle medicine, plant-based nutrition in general. And it's great to support the already plant-based community, such as many of the people that are listening right now already. But our goal is, as a PBNM organization, and me personally, my goal is to reach the masses, the general people, the people who are overweight, obese, diabetic, high blood pressure, heart disease. I want them to get this information. And so share this if you can with people who you know need change. But what I want to do with this whole Facebook Live thing in the future is I want to, we're having these group meetings going on with PBNM once monthly. And I believe in Chicago, I believe it's going to be 15 groups or so that are going to be meeting in January, and we're hoping to eventually expand that and get up to 50 groups after about a year or so, meeting in different areas once monthly, and we have a unified curriculum. For example, in January, we're going to be doing weight loss. So what I want to do with this, we're going to probably take a week or two break because of the holidays, but circle back at the beginning of January. And the next one I want to do is going to be with weight loss and plant-based diets and weight loss. It's January, people want to lose weight, and let's use this one as a huge way to get the general public in listening to this whole plant-based message and the power of plant-based diets to lose weight, but not only lose weight, but of course maintain good health long-term, which is what we want. You can lose weight on a cocaine binge, but that's not necessarily healthy for you, right? We want to lose weight in a healthy way, long-term, that's sustainable, that'll prevent heart disease and diabetes and brain disorders and all that stuff, which is plant-based. So what we want to do, what I want to do is go over a topic that's going to be weight loss and plant-based diets. You know, we could title it just like Dr. Greger's book in 2019 is going to come out called How Not to Diet, a follow-up to his How Not to Die book. But we'll talk about calorie density. We'll talk about why it is that eating plant-based and eating complex carbohydrates are good for you from a metabolic perspective, why that leads to weight loss, that good carbs are very good for you. Yeah, bad carbs are bad, but don't give all carbs a bad rap. So we'll talk about those things in detail with a nice PowerPoint presentation. But what this is going to be is the video that we're going to record for the first week of January. I would like to show it at our PBNM group meetings, so that the group leaders will have some support and we can send a good unified message to all of our PBNM monthly groups. So for example, we have our 15 places that are meeting, there are 15 different leaders. Some leaders are actually physicians, but other leaders are just our community members that aren't necessarily physicians. And so the people there might like to hear it straight from a doctor, what the topic is that we're talking about. So we'll record a video on the topic of the month, 10 or 15 minutes, not crazy long, maybe 20 or 30, and the group leader can decide to cut it off after 15 or 20 minutes if it's getting too long. But we'll have that group leader show the video to the group so that they get the good evidence-based scientific explanation for what the topic is of the month. The weight loss for January, February will be heart month, and March we could do diabetes, and April we could do brain health, whatever it is. And so like when diabetes month comes around, maybe we can get one of our endocrinologists to do the video, which could show, because actually Dr. Kaushik Reddy in Tampa Bay has a phenomenal endocrinologist involved in his organization that might be willing to do a quick 15 to 30-minute presentation like this, or maybe we could do a little Skype Zoom in session and talk about it so that we can get that message straight from an endocrinologist about why plant-based diets are great for diabetes, and it's actually now recommended by the American Diabetic Association. So these videos here that we're doing is not only for everybody to see as a live question and answer thing, but will also be used in our group meetings in the Chicagoland area, and we'll talk to the Tampa group and see if the Tampa area wants to just take the same videos, if they're going to form a similar group system. And eventually, if we can get this spread throughout the entire country and have hundreds or even more groups, even 1,000+ groups meeting throughout the country, all unified with a good evidence-based plant-based nutrition message, show this video, and we can talk about what PBNM is doing as an organization throughout these videos. That's going to really help to exponentially get our message out there and grow things. So that's great. So thanks, Rita, for joining. You're in Edinburgh, Scotland, and you follow plant-based diet, healthcare professionals. Good. And you're going to join them, spread the word. That's exactly what you got to do. So that's wonderful. That's great. So great. I guess that's all the questions that I see. So I appreciate everybody's time. Thanks for tuning in. And so join me back in a couple of weeks or so when we're going to talk about using plant-based diets to lose weight, and use that video as a lead into our January PBNM group meetings. If there's anybody that you know that you go to a holiday party or whatever, and they say, I want to lose weight, January 1st, I'm going to make my New Year's resolution, say, all right, you need to look at this video. We're going to talk about plant-based diets and weight loss. Check it out. Join if they want questions about plant-based diets and weight loss. They can come on in and join me in a couple of weeks and answer any questions that they have about it. Let's continue to grow this and grow this and grow this and get the message out. So thank you very much. I appreciate everybody being here. Let's keep spreading the word.